What differentiates your agency in the marketplace?
Well, the reason that I started my agency, I believe, is the same reason that we're different. I worked for many home care agencies after I moved here, and I realized very quickly that the demographics in Worcester, Massachusetts was changing. But I realized that the agencies that I was working with were still treating people like it was, not taking account of the diversity. And so I felt way before the word cultural competency became commonplace in home care, I felt that people needed to be trained. Home care, at the time, there was also very little diversity in the staff that worked home care. And so many patients, when they were admitted to home care, very quickly someone branded them as non-compliant and discharged them. Sometimes it was their diet that was different, say that was making their blood sugar not come down, or it was something else that was different. Sometimes the clinicians couldn't understand, and there wasn't a lot of interpreters. There was just one or two companies that did interpreter services around Worcester, and there was a long wait to get an interpreter. So clinicians were just winging it. And the more I was part of this, the more I felt something needed to change. This was really, really not the way I had envisaged home care to be, because if someone is, speaks a different language, you need to be there with them with that, being able to understand the language that they're speaking through an interpreter, all that. So what I did was in 2005, I decided I was going to go it alone. So I started an agency with the vision of embracing the diversity in Worcester, embracing people of different languages in Worcester. So one of the first things I did was I went into the different communities, the Southeast Asian community, the Spanish community, all the different Vietnamese community, and I found freelance trained interpreters who were willing to work with my agency. And I was able to negotiate lower rates for interpretation than what we got through different companies. And that helped us because the cost of interpreter till today is not reimbursed in home care. And I remember a long time ago, 2005, talking to the then Senator Kerry about it and saying, this is impacting home care. This is impacting the way people who do not speak English are being treated. And I remember him having a very good conversation with me at the time about, how this was happening and nobody was talking about it. Anyway, so I was able to put together a group of freelance interpreters who were willing to work with the clinicians, the nurses or physical therapists. And I basically put cultural competency training at the forefront of my agency training. So every new employee goes through cultural competency, and it's in our core values. And every year we do another cultural competency review test just to make sure that people are aware of it. People are aware that the diversity is in the city. You're going to treat every single patient with dignity, no matter the language they speak. So, up to today, I do have the same interpreters, many of them from 2005, who have become almost like part of my agency. And we have also got telephone interpreters for the languages that these freelance interpreters don't speak. And that gave us a different kind of bonding with the city. It gave us a different kind of bonding with people in the city, with the insurance companies that deal with a lot of minority groups in the city. They go to us first. They call us first because they know that one, we will not shy away from taking care of this patient because of the cost of interpretation. And then secondly, that we will really deliver quality care because we understand what the patient is saying. And for me, that's the biggest contribution I feel I've made to the city.